Ligand-gated ion channels. When the ligand binds, it increases the probability that the channel will be in the open state. Without ligand, the channel will be mostly closed. Let's use an example. When patient presents with seizures, which is a rapid depolarization, for seizures are benzodiazepine. Common ones are midazolam, lorazepam, diazepam. We mainly use midazolam for acute seizures. Mechanism of action. It binds to GABA receptor, which opens chloride ion channels, allows for rapid influx of chloride into the cell. As chloride rushes into the cell, the membrane becomes very negative, which makes it hyperpolarized. Something for you to continue to apply as you're learning physiology is the more negative the membrane potential, the more polarized we are. So we want a state of hyperpolarization. Why would we want a state of hyperpolarization? Well, in seizures, I told you it's rapid depolarization and we're having all this seizure activity causing convulsions in the body, right? So if I want to decrease depolarization, what I would want to do to the cell is hyperpolarize it. Get it as far as possible from depolarizing. We want to polarize it as much as we can. What happens is midazolam or benzodiazepine will bind to these ion channels around this synapse. Synapses propagate signals throughout the body. In the case of a seizure, the synapses are depolarizing very rapidly and carrying excessive excitatory signals. These signals cause a seizure. So one way to prevent depolarization is by hyperpolarizing the membrane, or in other words, making the membrane potential negative. Midazolam binds, or benzodiazepine binds to these GABA receptors, which open these chloride ion channels. Remember, we have a great concentration of chloride outside the cell. So as soon as the channel opens, all these guys are going to want to rush in. What becomes of the membrane potential? As we increase chloride concentration inside the cell, we become more negative. As we become more negative, we are more polarized, we are more polar, and more polar means less likely to depolarize, and therefore decreasing seizure activity. So to put it all together, ligand-gated ion channels are a receptor that when a ligand binds to increases the probability the channel will be in an open conformation. Without the ligand, the channel will most likely be closed. A good example of this is benzodiazepines, how they bind to GABA receptors and open chloride channels to hyperpolarize the membrane potential of the cell and decrease the polarization, therefore decrease synaptic firing and have a sedative property. In seizures, this works great, as it is rapid and uncontrolled depolarization of synapses.